A typical scenario in some slums in Lagos. Cooking and selling under unhygienic conditions, happy children playing on polluted streets, all rather oblivious of the health risk they are exposed to. Many of these Lagosians are also in the dark about the cholera epidemic hitting some states in the country, including Lagos State. According to the World Health Organization, cholera is an extremely infectious disease. It affects both children and adults and can kill within hours.
Cholera is caused by a microorganism called Vibrio cholera. It is commonly transmitted when people eat food or drink water that is contaminated with this organism. This organism, where it happens when there is poor sanitation, when human excreta is poorly disposed.
Drinking water or eating food contaminated with the cholera bacterium, medical experts say, is an open invitation to the disease. And in an epidemic, key sources of contamination are often from feces of an infected person, fecal polluted water, and street vended foods. The food vendor down the road or eatery could be likely avenues, particularly those whose culinary arts challenges the appetite of low-income earners for natural foods or African delicacies.
So when they get this water, if they use it to wash the fruit salad, the abacha, whatever they cook, they will have the cholera. So that's why it's happening now because we are in rainy season, so the water level is even higher up, so that if you are looking at a well that maybe like 100 meters deep before you get water, now maybe at like 40 meters you will see water and the water appears clean to your eye, but this water is contaminated with excreta. Normally WHO says the distance from a well should be at least 30 meters from a sockaway pit. But in Lagos, here is densely populated and overcrowded. You could have a well, maybe some other person can have his house with sockaway pits here, and then there is a fence, and then the next compound beside it there is a well.
Other foods prepared without cooking, fruits and salads, experts say, are not left out. Just as ignorance is no excuse in law, it is certainly no excuse when it comes to health, safety and well-being. Some who have overlooked sanitation and hygiene in food preparation have paid dearly for it. In Lagos State and in other parts of Nigeria, many have died from the cholera disease.
Most of the cases we've had are due to people that have eaten food that is poorly cooked or undercooked. Example is abacha. This African delicacy called African salad, because it's not usually cooked.
Although the Lagos State government, for instance, is making efforts to prevent the spread of cholera, medical experts and environmentalists say lack of personal hygiene, access to unsafe water, poor sanitation and food prepared in an unhealthy manner could increase its spread.
No matter how we try to address this issue, because the standards are not improving, we still don't have good food security. Foods are continuing to be open in stores or everywhere. Drains will continue to be polluted. Our water standard, everybody drinks from well or borehole, as the case may be. We are not likely going to see an end to this kind of cholera epidemic in a very short time. It is obviously going to be a continuous experience from time to time.
Medical experts advise that enhanced hygiene and food safety practices is key to preventing more outbreak of cholera.
If you have any contact with someone that already has cholera, you should make sure you wash your hands properly with soap and water before eating anything. And then also too, the water you drink, make sure the water is properly boiled.
Right now, I am at Aliwo Street under the Apapa Igomu local government area of Lagos State. Now, this street is highly polluted. The gutters don't flow, and residents say it has been like this for over 8 years. I am also standing in front of what used to be a public toilet, a facility that was built for residents by the state government. It has been under lock and key for a very long time. Before it was abandoned, a lot of people around here used it, and so residents fear that feces and wastewater and effluents from this facility was not removed before it was locked. So with effluent flowing freely into the streets, when it rains, water from the feces and the polluted stagnant gutters mix together and flow into the houses of residents. We are always sick. A child who lives in this building died as a result of this situation. He fell into the polluted water and died. There is another case of an elderly man and woman that died last year when their home was flooded. It's the same story this year. Once the place gets flooded, people die, this woman lamented.
We want government to help us to make the drainage go straight into the canal, so as there will be no cholera or any disease to attack to our children or ourselves.
Compounding the situation of residents are buildings without proper sewage plan. Effluents from toilets in the crowded neighborhoods flow directly into stagnant gutters.
Most people don't think about all that. So the soakaway pit, the feces from, they will commonly contaminate the well. And now that water level is high because of rainy season, then anybody that fetches water from that well and use it without properly boiling it or cooking the food properly well with it will have cholera.
With many already down with cholera in Lagos, these Lagosians say their fate hangs on a quick intervention.
This particular street you are seeing is a road to other streets, and since there is gutter there and a flood of water, nobody can pass through this place, even though vehicle cannot come in, and we are so afraid.
The reason for the neglect of Aliwo Street in Apapa Igomu local government area and many like it by relevant authorities require answers.